enough. Fair enough.
Number one thing, don't take advice from some asshole on the radio.
All right. Let's.
Okay. This is Lee in
Lee.
North Alabama, and I've got a question regarding some HRT that I'm doing.
Okay, HRT being hormone replacement therapy, presumably testosterone, but not necessarily. We'll see.
When I did my last blood sample, I was at a 200, and so.
Okay, so listen, when we give out these raw numbers like this, we're not using the units. I don't know if he's talking about nanograms per deciliter or what the units are, but I'm assuming that's low, and if it's low in his lab, then the low normal in most labs is right around 350, if I'm not giving out the units, and normal is anywhere considered to be 350 to 850, somewhere in there. Depends on the lab, so you got to look at the normal range. But just remember that if you're in the low normal range, you're probably actually low.
And if you feel bad and you're in the low normal, that is
there important. You go, Tace. You're going to get one of those.
Give yourself a bill.
That is exactly right, because symptomatic people in the low normal range have been shown in studies to derive benefit from treatment from hormone replacement therapy, even though, quote unquote, technically they're in the they're technically, quote unquote, low normal or normal, and they're not. It's because there's so many people are low that when they determine what's normal, they're including a bunch of people that are low because they've never been diagnosed in that average. And so it skews the normal range low. So all of the urologists that I've talked to say if you're low normal and you have the symptoms of low testosterone, that you should be treated. Okay, anyway, let him complete.
Through some doctor guidance and stuff, we've started the therapy. I'm doing injections.
Okay.
Every 10 days.
Okay.
And so
there's lots of things you can do. He's giving himself shots. Some people do the gel. Some people do pellets. There's all kinds of things you can do. So
injecting in my left leg because I'm right-handed, I can control it better. And I inserted the needle into my leg. This was a week ago.
Oh, no.
And when the needle went in, that area and that muscle where the needle penetrated my leg cramped, and the needle actually racked in one direction and then stood back up. And I pulled the needle out, and I managed to get the injection in.
Yeah.
But I'm curious, why in the world would it have done that? Did I hit something?
Yes.
Or
you stuck a needle in your leg. Well, that's what you
what? I just don't want that to happen again because it hurt like some bitch.
Yeah. Go ahead, Scott.
I would say it sounds like the motor point in the muscle.
Yeah.
So it's kind of where the nerve innervates or enters the muscle. And it's the biggest bulk of it. And if you'll hit that thing just right, it will cause a lot of times a spasm.
Yep.
And my suggestion would be next time you do it, poke around and find a spot that's not.
You mean with your finger?
With your finger, yeah.
Not with the needle.
Yeah, not with the needle. Yeah, with your finger, kind of poke around and palpate, mush until you can find a not real sensitive spot. And that's probably a better place to go in.
Yeah.
And I would, one other thing I would say too is he might be able to do it if he's right-handed, do it in his right hip.
Yes.
The buttocks is where I would do it.
Well, I don't know if I
your
go
leg.
with the hip. I don't know. That's a tough one because you got to go to the right particular quadrant in that gluteus area. And I do think the thigh is easy to get to, but if you're right-handed, you can do your right thigh. Dude, that makes me wonder where he's injecting it.
Yeah, no.
So this is the correct way to do this. You should use the vastus lateralis muscle of the thigh. So let me tell you where that is. You divide the thigh into 3 equal parts vertically, not horizontally. So going from hip to knee, you draw a line from the hip to the knee, divide it into 3 equal parts, and you're going to go to the upper top part of the middle to lateral section. Okay, and then if you do that, there's no nerves and stuff over there, and that really, for me, that would be easier for me to hit from the right than from the left. Let me try it from the. No, it's easy either way.
Yeah,
it's either way.
Well, there's cutaneous sensory nerves, but no.
Well, of course,
nerves.
No. But I'm talking about there's the femoral arteries and stuff go on
that's
the inside
of
part.
the leg, right?
That's right. Yeah. That's right. Yeah, very good, Scott. You know your anatomy.
Yeah, buddy.
Give yourself a bill.
So, dude, if you want to email me, I'll send you a picture of where you need to be going.
Mm-hmm.
But Scott's right. Even then, like, you can poke around, and if I poke just right, I can make that muscle spasm.
Yep.
It jerks. It's really a reflex jerk, is what it is.
And it's called a trigger point or a motor point if you want to kind of do a little research on that. But that's believe it or not.
I just looked on the camera. It looks like I'm masturbating.
Oh, funny.
Because I was
Nice.
I was poking my leg. If I do that, it looks like. Can you see that?
That would be.
I'm sorry for the people who are listening.
And that would have been a whole lot more motion than you probably need. But
No, not for me. No,
anyway, but
I was in the bathroom at WRAL TV a million years ago when I worked there. There was the weather guy was a guy named Bob DeBartoleben, and the news guy was a guy named Charlie Gaddy, right? Mm. And so they're both in there pissing at the same time. And the one guy, and this isn't a great joke, but it's just something that I remember. And Charlie Gaddy said, "Oh, he bragging about what a giant cock he had, right?" Mm-hmm. And he said, "Well, they need to lower this urinal for me." And Bob Bartleben, without even missing a beat, said, "Well, they need to raise it for me 6 inches off the floor."
You get nothing.
Oops, wrong thing, but it worked anyway.
Doing great with sound effects today.
I know, sorry. I was going for that.
Oh, good.
All right. Yep, those were the good old days. Old Charlie Gaddy and Bob DeBartoleben, and doing championship wrestling on weekends.
Yep.
Ric Flair recently did, quote-unquote, his last match.
Yeah.
And our buddy Shuli Egar was on the roast of Ric Flair.
Oh, my goodness.
And our friend Vinny Paulina was there to document everything.
How did the match go?
I don't know.
Okay.
He didn't die. All I know is he didn't die. I also hear that he was a complete you-know-what.
Oh, really?
Now, I worked with Mr. Flair for 3 years. Mm-hmm. Never spoke a word to me, not once. Funny. Now, I was a peon. I was just the audio engineer and sometimes cameraman. But, never. I don't think any of those guys would remember me. But I've got some great stories about working with them. That was cool. Wahoo McDaniel, Baron von Raschke. I've told the story about Igor the Polish Prince and his Polish sausage. Have you ever heard that? I've told you that story, Tice?
I don't think I've heard the Polish sausage.
Do you know this
story.
one?
Yeah, I think so. Yeah.
This guy, his name was Igor the Polish Prince, and he had that sort of generic Eastern European, "Oh, I am Igor, Polish Prince," like that, right?
Yep.
And he was from Kernersville, North Carolina, I think. I think that's where he was from. And he would get on, we would do these commercials, right? And there were we did 70 commercials on every Wednesday, 2 for each of 35 different markets.
Okay.
And they had the announcer, "Tonight in Dorton Arena," or "Tonight in Charlotte Coliseum." And then Blackjack Mulligan would get up there and he'd go, "Wahoo McDaniel, if you're listening." Of course, he's listening. He's sitting right there because they're all on tables on either side of this thing because we had to get these things whipped out. Well, anyway, Mighty Igor would get up there and he would be gnawing on this Polish sausage. He'd never take a bite off of it and chew it and swallow it. Mm-hmm. He'd just gnaw on it, right?
Gross.
It was just kind of gumming it.
Ugh.
And so that was every Wednesday. Well, I when I would come and do the morning show, which was at 6 a.m, so I lived in Athland, North Carolina. It was an hour away, so I'd have to get up at 4 to get there by 5 so that I could set up for the show at 6. And one day I was cleaning up the living room set where they all sat and did this sort of chatty show, farm show in the morning, and I'm cleaning the sofa, and I lift up the cushions to clean under the cushions, and there, lo and behold, was Mighty Igor's Polish sausage underneath one of the cushions. And what this guy was doing was when we would be done, he would shove that thing under the cushion, And then when he'd come back the next week, he'd grab it and stick it back in his mouth and gnaw on it. Now I understood why. No, yes, of course. What else? Why other reason would it be there? There's trash cans everywhere. He could have just thrown it in the trash. He was saving it for next time.
Oh my, that's awful.
So it was so great. I have a million of those stories with those guys. But anyway, maybe we'll do a wrestling show sometime.